We, from our training perspective, we call it inequality, because we think that inequality is a broader approach to the problems we all face now. And the problems also change and evolve over time. And that's why we were first established 1 year ago, and then already tackled the inequalities we all kind of intuitively felt we need to address. And one particular inequality we all recognized is the access in various dimensions: access to education, access to certain conferences, access to treatments, access to clinical trials, access to communication. And that's why we first wanted to identify what the inequalities really are at the moment. And then we did an international survey last year and could publish this in the Lancet Hematology just on Saturday now, which is free for everyone to read, where we identified obvious inequalities and differences between certain countries across the globe. So the survey covered almost all continents except Antarctica. And there we found obvious inequalities in access of allogeneic stem cell transplantation and also autologous transplantation. But the biggest difference was regarding newer therapies, including cellular therapies with CAR T-cell treatment, where we found significant differences according to the income status of countries and the access to these treatments. So only 5% of all countries with lower or upper middle income had even access for trainees to this treatment, which is a huge difference to high-income countries. But also we identified differences even between high-income countries regarding this new cellular therapy. So we need to take into account this: if newer treatments with certain financial toxicity or financial burden, as we call it nowadays, are more and more used, that the differences rather increase than decrease. And we need to be aware of that, and we need to tackle that.